and welcome back to Southwest News. We have a groundbreaking story. My name is Erin Asher, and here in the United States, we are seeing a rapid rate of HIV infections in the minority demographics. Human immunodeficiency virus, also called HIV, is a serious infection that weakens a person's immune system by destroying important cells that fight diseases and infections. Since we will be talking about very sensitive information, viewer discretion is advised. According to a report sent out by the CDC in 2015, the U.S. HIV diagnosis has decreased over the past decade, but some groups experienced increases. Dr. Fisher is here with me to discuss what HIV is, how it can be prevented, and why it is affecting certain groups, and what kind of treatments are available.
Thank you, Erin, for having me here.
Thank you for being here.
Although HIV infection has been on a steady decrease among the general population, some minority groups have seen an increase. The Latino Hispanic community, as well as African Americans, are considered to be more at risk of contracting HIV.
Oh wow! Could you explain in more detail for our viewers who may not be aware of what HIV is?
Of course! Let me explain what HIV virus is. Human immunodeficiency virus is transmitted through certain bodily fluids and attacks the immune system. More specifically, HIV affects the T cells that help fight off infections. As the virus kills off all the T cells, the immune system becomes weak, and it makes it harder for the body to fight off infections and diseases.
It seems like a very deadly disease.
It can be, Erin, but the person does not die from HIV. They die from opportunistic diseases that enter the body after it becomes weak. After the T cell count is below 200, then one is considered to have AIDS.
So why do you believe that it has been affecting the Hispanics and African Americans?
Anybody can contract HIV, but the highest HIV rate is high among gay, bisexual, transgender people who engage in risky behaviors, such as multiple sexual partners. It is also higher in those who inject drugs with syringes. When you live in a community where many people have HIV infection, the chances of having sex or sharing needles or other infection equipment with someone who has HIV are higher.
How do you contract HIV?
HIV is most commonly contracted through sexual transmission or infected needles, although it can also be spread from a mother to a baby when breastfeeding. This is because HIV can be transmitted through certain fluids such as blood, semen, vaginal fluids, and breast milk. These fluids come in contact with mucous membrane or damaged tissue or be directly injected into the bloodstream with a needle or syringe for HIV to be transmitted. Mucous membranes are found inside the rectum, vagina, penis, and mouth.
How do you know if you contract HIV? Are there symptoms?
Some people may experience a flu-like illness within 2 to 4 weeks after the infection, but some people may not feel sick during this stage. Flu-like symptoms include fevers, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, or mouth ulcers. During this time, HIV infection may not show up on an HIV test, but people who have it are highly infectious and can spread the infection to others.
You mentioned stages. Can you tell the viewers what they are and what the symptoms are?
Of course! Stage 1 is called acute HIV infection. It happens within 2 to 4 weeks after infection. People in this stage experience flu-like symptoms that may last for weeks. They may be unaware that they are infected because they may not get sick right away. Stage 2 is called clinical latency. This is also known as the HIV dormancy period because while the HIV is still active but reproduces at slow rates, at this point it is chronic HIV infection, and people may not get sick or feel any symptoms at this stage. This stage lasts about a decade for people that are not taking treatment for HIV, and several decades for people taking treatment. Stage 3 is called acquired immunodeficiency syndrome, or AIDS. This is the most severe phase of infection. People in this stage have badly damaged immune systems and get an increased number of illnesses that turn severe. Without treatment, people in this stage only last about 3 years.
Is there any way we can prevent this disease?
Yes. Practice abstinence or use protection such as condoms when having sexual intercourse. Do not share needles. If you are a mother with HIV, do not breastfeed your child.
How is HIV diagnosed?
To know if you have HIV infection, either a fourth-generation antibody antigen test or a nucleic acid NAT test is necessary. The nucleic acid test looks for the active virus in the blood, while the antigen or antibody test looks for the HIV antigen or antibodies in your immune system.
What are the treatments for HIV or AIDS?
There is no cure for HIV or AIDS, but treatment called antiretroviral therapy or ART can help keep you healthy for many years and reduce the risk of spreading HIV to your partners. There is also a new vaccine for pregnant mothers that prevents spreading HIV to the baby. If you have a high risk of getting HIV from sex or injected drugs, taking an HIV medicine called pre-exposure prophylaxis daily or PrEP can greatly reduce your risk of HIV infection.
Thank you for taking the time to come out and speak with us today.
My pleasure. Thank you for having me here.
You heard it here first. Thank you and have a great night.